Good evening, everyone. Uh, Welcome to the course Fabrication Techniques for MEMS-based sensors from the clinical perspective. I'm the course TA Rayan Jisma. So, this is our week 9 live interaction session. This is about me, and every week from 6 p.m. to 8 p.m. on Monday, we have this live session. First, we'll start with a quick recap of the content that was covered in week 9. So, which is fabrication of a smart catheter. Like we learned about smart catheter and like how a flexible force sensor can be included in that smart catheter, and also we learned about tissue and cell culture techniques. Okay. Now let us move on to the problem section. The first problem is problem 1. In order to distinguish healthy heart from the irregular beating of the atrium, the diagnostic tool containing electrodes for electrical mapping of the heart signals is option A, atrial fibrillation, option B, electrocardiogram, option C, electroencephalogram, option D, echocardiogram. So what is the correct answer for this question? We want to distinguish whether the heart is healthy or whether like the person is suffering from any particular disease or not. So we need to use some kind of a diagnostic tool in order to treat the patient. So we need some kind of diagnostic tool in order to like find whether a person is suffering from any disease or not. So what kind of tool are we using in this for electrical mapping of heart signals? So uh, oh, first let us see what are the options that are feasible for this question. So here we have option A is atrial fibrillation. Okay, that is a disease. So that is not the correct answer. But then we have other three options. One is electrocardiogram, electroencephalogram, and echocardiogram. So one of these three may be correct. What is here the correct answer is option B, electrocardiogram. So from the name you can know that electro means we are measuring electrical signals and cardio means from the heart. Okay, so in option C, we are having electroencephalogram, which means we are measuring the electrical signals from the brain. Encephalo means the brain. And in option D, we have echocardiogram, where we are measuring the echo signal from the heart. Okay, so what is electrocardiogram? It is one of the simplest and fastest test in order to uh, see the electrical activity of the heart. So what they do is they stick some patches on the skin at certain spots, where they place on the chest, arm, and legs. So these are electrodes. They are then connected to the ECG machine by means of some lead wire. So this ECG can be used to find whether a person is having any irregular heartbeat. So this irregular heartbeat is also called as arrhythmia, or if a person is has suffered from a heart attack before, or if somebody is having a chest pain, then they can try to find out what is causing a chest pain. Let's say if the person is having chest pain because they are having narrowed heart artery or blocked heart artery, then that they can find out using a ECG machine. Okay. So before so that we can find out using a ECG machine. Um, hmm. so we know that like heart is pumping blood to various organs. So like there is some kind of electrical activity that is occurring in the heart that will cause it to pump the blood. So what happens is, like our body, when it wants to make some muscles like contract or expand, it will send some electrical impulses. But for heart, the electrical impulses are coming from the atomic nervous system. So what happens is, the brain will send the signals to the atomic nervous system, to the heart's electrical system. Then once the heart's electrical system activates, it will send a pulse through the heart muscle. Because of the electrical pulse that is moving through the heart muscle, the chambers of the heart will they will squeeze in a particular order, and that's how we are getting a heartbeat. Okay, so if we see ECG wave, then the heart is generally like it consists of different types of waves. So this is roughly how it will look like. Sorry. Okay, so let me draw an ECG wave. We have something called as P wave. Then we'll have a dip which is called as Q. Then a peak R, and again a dip. So this is called as QRS complex. And then we'll have a T wave. Okay. So this is P wave. This is QRS complex, and then this is T wave. So, like in ECG, what we measure is this wave, and here, like each part of the wave will tell us different information about the heart. So, this P wave happens when like the electrical excitation is spreading across the artery of the heart. What happens is, because of that, the artery will contract, and then it will pump the blood into the ventricles, and then once the blood is gone into the ventricles, it will relax. So by the time the blood reaches the ventricles, the electrical impulse will reach the ventricle. So this we can study, like we can see in this QRS complex wave. And then once this impulse is reaching the ventricle will contract. Then this T wave is telling that the impulse has stopped spreading, and the ventricles have relaxed again. So we can study the electrical activity of the heart. By that we can kind of understand what is going on, like so which portion of the heart is contracting. If there is any abnormality in any portion of the way, from that we can find out there is some issue. So that is electrocardiogram. Then electroencephalogram is a study of electrical activities of the brain. So we generally know that the brain consists of neurons. So these neurons will communicate with each other using electrical impulses, and there are different kinds of waves depending on how the wave is present. Like we can tell that when a person is awake, the waves will be different. When a person is sleeping, the waves will be different. Also, if somebody has some kind of issue in the brain, like if they are affected by stroke, or if they are having any disease like Alzheimer's and so on, the electrical activity in the brain will be different. So by that we can kind of diagnose any diseases in the brain. That is electroencephalogram. Echocardiogram is also like it is for measuring the echo pulses of the heart. So echocardiogram is generally ultrasound test. So with that we can see the images of the structure of the heart as well as the function. Uh, Again, we can use to determine if there is any valve disease or like certain cardiac conditions we can study using this. However, this will take a long time and is a more detailed test when compared to that of the electrocardiogram. Okay. So, so here both electrocardiogram and echo are both used for studying the heart. However, this electrocardiogram, we are using electrodes and we are mapping the electrical signals of the heart. In echocardiogram, what we are doing is we are using sound waves and we are seeing pictures of the heart. From the pictures, we can see like if the valve is functioning properly or not when the heart is beating, and those things we can study. Okay, is this clear? Now let us move on to the next question. Problem 2. The non-ionizing radiation used in ablating the tissue is option A, infrared, option B, radio frequency, option C, microwave. Problem 2. The non-ionizing radiation used in ablating the tissue is option A, infrared, option B, radio frequency, option C, microwave, option D, X-rays. So which is the correct answer? So here it is mentioned in the question that the radiation is non-ionizing, right? So we have to look into which one is non-ionizing. Okay. So we know X-rays are ionizing radiation. That is wrong. And also, if you see microwaves, radio waves, and infrared waves, they all come under non-ionizing spectrum. So among these three, which of them is used in ablating the tissue? And what is the correct answer? The correct answer here is radio waves. Okay. So first, let us look at these different kind of waves. Okay. Um, so here in this spectrum, we can see that it is divided into non-ionizing and ionizing radiation. In non-ionizing radiation means it does not have enough energy in that particular wave in order to ionize atoms or molecules. So it means that like there is not just enough energy in that particular wave in order to remove any electron or like add any electron to a particular molecule. That's how that ionization happens, right? So like if it is ionizing radiation, it will affect the cells. So generally we will not use ionizing radiation for ablation. Okay. And like so in non-ionizing radiation we have radio waves, infrared, and microwaves. And here you can see that both here in non-ionizing radiation, we can see that both radio waves and microwaves are there. But compared to radio waves, microwaves are very much like they are having higher energy. So which means they can supply very much high energy. So we are using radio waves only. So what is ablation? Ablation is the process by which we are removing a body part or destroying the function of a particular tissue, and then we are removing the tissue. So generally we can do this ablation by either surgery or certain drugs or radio frequency or heat or other methods. And here in this RF energy is used to produce heat. So this heat will destroy the tissue. And ablation you can tell as either burning or killing a tissue. How this RF energy will ablate a tissue is that first it will cause some coagulation. Then this coagulation happens because there is a large amount of heat that is generated when we are passing high frequency electrical current through the tissue. Once there is coagulation of the blood, then there will not be any supply of blood to the cells. Once that happens, when the supply of blood stops, then the cell starts to die, and this is called as necrosis. So, if necrosis of the tissue happens, that means the tissue has died. So that is how they are doing the tissue ablation. Okay, is this clear? Hmm. So how are we doing the tissue ablation? Uh, the first thing is that we are using RF. We know that we are using RF waves, right? RF energy like is used to pass the at the RF frequency we are passing electrical current through the tissue. So what happens is, as a result of that, the tissue will start to heat, and once it starts to heat, due to that, there will be some coagulation of blood in the tissue. This coagulation means that the blood flow would have stopped to certain parts of the tissue, and because of that, the cells in the tissue will start to die. This is called as necrosis. This will eventually will lead to the complete death of the cell. That is called as ablation. And also one advantage of using RF energy is that it is slow moving, and also it is non-ionizing. Like, it does not affect the nearby normal tissue. Okay. So when we are doing tissue ablation in a particular region, we want to just remove the desired tissue that we want. We don't want to affect the other healthy tissue that are nearby it, and that's why we go for radio frequency instead of other higher frequencies. And also we don't want to use ionizing radiation because it will cause damage to the tissue. Earlier people used to use AC signal, low frequency AC signal, and if we when we are doing tissue ablation in the heart, the advantage is that it will not stimulate any heart muscle or any nerves, and without anesthesia they can do this tissue ablation. Okay. Problem two, the non-ionizing radiation used in ablating the tissue is radio frequency. Now let us move to problem three. Which among the below sensing parameter, when integrated with a cardiac ablation catheter, has shown to reduce reoccurrence of atrial fibrillation? Option A, viscosity; B, force; C, fluid velocity; and D, electrical impulse. What is mentioned here is we are sensing some particular parameter. Um, so what it means here is that we are sensing some particular parameter, uh, and we are using this parameter as a feedback for the cardiac ablation catheter. By having this particular feedback mechanism, we are able to reduce the reoccurrence of atrial fibrillation. Cardiac ablation is one of the methods used to treat atrial fibrillation. So when we are doing ablation of the tissue, we should ensure that the ablation is done properly. Otherwise, there will be either reoccurrence of the disease, so they'll have to do ablation again, or there may be certain other complications. So we need to measure something. What is it that we are measuring? Okay. So these kind of catheters are only called as that smart catheter, right? In the recap, I think you would have seen. So what we are measuring here is force. The correct answer is force. Okay. So what happens is that at the tip of the catheter, we will try to measure the force of contact, and if we measure the degree of contact with the catheter with the heart tissue, then we can determine how the lesson will be. Let's say if we are giving too much force on the tissue, then it may pop, or there may be some holes which may come, right? And like if we do this ablation without any contact force sensing, then what will happen is like it can increase the complication, and also it can reduce the success rate. So that's why by having a catheter which is giving which is also able to measure the force that is applied to the heart tissue, we can precisely control how much force that we want to give to the tissue, so that we can do the ablation properly. Okay. So again, to measure force, we can use MEMS based devices in order to measure the force, right? So I think we'll come to that in another question in later. We'll come to that in another question in later part of the course. Okay. So now let's move on to problem 4. Surface profile, such as roughness of a fabricated MEMS-based sensor, can be understood using option A, scanning electron microscopy, option B, atomic force microscopy, option C, transmission electron microscopy, option D, Fourier transform infrared spectroscopy. So, like you want to measure the surface roughness, surface profile, so which will tell us about the roughness of a fabricated MEMS sensor. So, what can we use to measure it? Okay, so here we have like different kinds of microscopy, right? Scanning electron, atomic force microscopy, transmission electron microscopy, and D is Fourier transform infrared spectroscopy. Okay, so first let us look at what each of these options are, and then we'll come on to what is the correct answer. Okay, so here you can see images of a SEM. So SEM is scanning electron microscopy. What it does is it is a type of electron microscopy where we focus like some beam of electrons, and we use it to scan the surface of a specimen. Since we are using electrons to scan the surface and see the image, the resolution of this is very small, so it can reach to nanometer scale. And when we focus a beam of electrons on the sample, there are various the electrons can interact with the sample in a different way. One is either they can get scattered from the sample, so or the electrons can either get scattered from the sample, or some electrons can be generated from the sample. Because the incident electron beam is falling on the sample, there can be some electrons that will get generated from the sample, and some electrons that can get scattered from the sample. So the electrons that are getting scattered from the sample are called as backscattered electrons, and the electrons that are generated from the sample are called as secondary electrons. So to detect both of the electrons, we have two kind of detectors, and these detectors will be used to form optical images from the by collecting the electrons that are coming. Okay. So this is SEM. So SEM is scanning electron microscopy. So here we can scan the surface. One important thing here is that we'll also see something called TEM, transmission electron microscopy, later. So there what happens is the electrons will get transmitted through the surface of the sample. The electrons will get transmitted through the sample, and that is because the sample is very thin. Compared to SEM, the sample is very thin. So this is SEM. Okay, then next we look at AFM. So AFM is what? Atomic force microscopy. So here you can see the block diagram of AFM. Here we have a cantilever, and that is having a tip. I think we saw this in one of the previous live sessions as well. So the cantilever tip is very sharp, and in some like AFMs, the cantilever tip is like pyramidal in shape. So the working principle of this AFM is that like we will have a cantilever assembly that will interact with the sample by like some kind of tapping motion, and when the cantilever is moved along the sample, the tip can move up or down. So this will cause this cantilever also to move up or down depending on how it moves, like by scanning a laser or at the edge of the cantilever, and by sensing the reflected light using a photodiode, we can like determine the displacement of this cantilever as it moves through the sample. So by that we can find out the roughness of the sample, as well as we can find out the topography. Okay. So and there are to do AFM, there are like many kind of modes called as tapping mode. So in that, what we do is like we either actuate the cantilever by using a piezo electric material, or there is also something called as photothermal actuation. So using either of the methods, what we do is we actuate the sample. Using either of the methods, we actuate the cantilever, and we will like move the cantilever along the surface of the sample in order to get the information about the topography of the sample. So this is AFM. Then next we have TEM. TEM is transmission electron microscopy. So here like the working principle is similar to that of light microscope, and since here we are using electrons to image the sample, this is having a better resolution compared to that of a optical microscope. Okay. And here the sample is generally very thin. So whatever electrons that pass through the sample are like they are captured on some detector, and then from that the imaging is done. Okay. So the difference between the transmission electron microscopy and scattering is, scattering electron microscopy, it will just give you more information about the surface of the sample. The electrons will not penetrate through the sample. Whereas in transmission electron microscopy, we are studying the electrons after it penetrates through the sample. Okay, so the fourth option is Fourier transform infrared spectroscopy, which is also called as FTIR. So this is generally used to study different molecules or atoms uh, of gases, solids, and liquids. Okay, so what happens is that so in the name itself we have that infrared spectroscopy, right? So we are trying to study the how the molecules or atoms interact with the infrared spectrum. So how they are observing the infrared radiation. When any molecule is exposed to infrared radiation, what will happen is like the molecule, depending on what type of molecule it will absorb radiation of particular wavelength, and that will cause the vibration of the molecules, and during the process of vibration they will like come from the excited state to the ground state, or they'll go from ground state to excited state. Then again, depending on that, they will emit some sort of radiation when they move between states. By studying the radiation that is emitted, we can determine uh, what what kind of molecule it is. So by analyzing the infrared spectrum, we can find out what is the structure of that particular molecule. So here we can study both the absorption spectrum as well as the emission spectrum. So what kind of wavelength the particular molecule has absorbed, or what kind of wavelength it is emitting. Okay, so now that you know what each of these options are, which is the correct answer for studying the roughness of the surface, it is atomic force microscopy. Okay, so it consists of a cantilever with a tip, The tip is moved across the sample depending on so since if the sample is having a particular terrain, then what will happen is that as the tip is moved across the sample, the displacement of the cantilever will change. Then we will try to sense the displacement of the cantilever by shining a laser light on the uh, tip of the cantilever like this, and then the reflected laser light is then sensed using a photodiode. So this will give us the displacement of the cantilever. Then again, this is also given to some feedback electronics, and that is used to actuate the cantilever. Now let us move on to next question, problem 5. Metals such as gold are deposited for sensor interconnects and contact pad. However, the metal deposition is always preceded with a 10 to 50 nanometer chrome or titanium deposition. Why? Option A is increasing the overall metal thickness. B. Improves the binding strength, thus promotes adhesion. C. Corrosion inhibition. And D. All of the above. So which one is the correct answer? So this also you have seen in previous sessions that we always deposit some kind of metal before we deposit gold, right? So what is the correct answer? Okay, the correct answer is option B. Improves the binding strength, thus promotes adhesion. Okay. So let me tell you why it is. Okay. So uh, gold is what kind of metal? It is a noble metal, right? So that means it will have low chemical reactivity. That's why they are called as noble metals. And because they don't have much of a chemical reactivity, they also don't get adhered to the substrate very easily. That means they don't stick very strongly to the substrate. So what happens if a metal does not get it's not stuck properly to the substrate? It will start to peel off, or the film will start to come out separately. And also we cannot say that the performance of the device will be good, right? So we want the metal to be properly stuck to the substrate. So for that we are using some kind of adhesion layer, and chrome titanium are some examples of adhesion layer. So they are more chemically reactive when compared to noble metals. So that's why we are depositing them first like a very thin layer, and then we are depositing gold. Okay, so these are metals like chrome or titanium. They will increase the adhesion because they will bind chemically to the substrate. Okay, so there is also another thing is that if your gold, if you are depositing 200 nanometer of gold, then you will deposit only 10 to 15 nanometer of chrome or titanium. The reason is that we don't want the titanium to make any huge effect in the performance of the device. Like you would have designed your device with gold electrodes. So the gold should be the determining factor, and the titanium is just used as a adhesion layer. That's all. Okay. Is this clear? Now let us move on to the next question. Problem 6. Passivation layer is used in microelectromechanical system, MEMS system. So which passivation layer is used? Option A, silicon dioxide, which is SiO2. Option B, trisilicon tetranitride, which is Si3N4. Option C, titanium dioxide. Option D, all the above. So which is the correct answer? It is used as a passivation layer. So which is the correct answer? Okay. Here, you can see that all these options are insulators, right? Silicon dioxide is an insulator. This is silicon nitride, that is also an insulator, and TiO2 is also an insulator. So we generally use. So which of them are we using as a passivation layer? The correct answer is all the above. Okay. So what is a passivation layer? A passivation layer is some kind of like a layer that is acting like a shield, and it is applied on the surface of the devices in order to protect it from like any other environment. Okay, and especially we apply this passivation layer on top of like metals and so on. Let's say we are having a MEMS device which we want to dip in a liquid. If we are having metal electrodes that is exposed, then like the like if we are dipping it in some ionic liquid or something, then that ionic liquid will form some kind of pathway for like any two metal uh, electrodes that are present in that particular device. So it will kind of short the device, so you will not be able to operate it properly. So in those cases, what we'll do is we'll have a thin layer of passivation layer around the device. So it will act as a insulator, kind of insulator between the like device electrode as well as the external environment. Okay. So in this, all the three of them can be used. And generally, when we are doing for passivation layer, we may need some conformal coating. I mean, it should be able to coat uniformly everywhere. Next, now let us move on to problem number 7. Subculturing cell lines decreases passage number. Is it true or false? Mm. So subculturing cell lines, does it decrease passage number or not? What is the correct answer? Okay. So first is what is cell line? So cell line is a particular population of cells that can be maintained in a culture for a particular amount of time. Okay. So, and while we are maintaining in culture, it will have the it will maintain its function as well as any like phenotype that it is having. It will maintain the function as well as it will be stable. Okay. And these cell lines are generally clones of a particular cell, so they are from all from a same ancestor cell. And what is passage number? Passage number is like how many times we have like subcultured the cell. That is, we have harvested and reseeded into multiple daughter cell cultures. So, means passages, we are transferring the cells from one culture dish to another. But again, like the number should increase only when we are reseeding the cell, not while freezing. So here, uh, okay. So what is a cell line? Cell line is a particular population of cells that can be maintained in a culture for an extended period of time. And while these cells are maintained in a particular culture, they will retain stability of their like whatever phenotypes that they are having, and also they will maintain their cell function. So how these cell lines are generated is they are the clones of one particular cell. Okay. And okay, so next, what is passage number? Passage number is how many times we have subcultured a cell line. That is, how many times we have transferred the cell from one particular cell culture to another particular cell culture. when we are transferring like the cell line from one cell culture to another, uh, like if we are following this process called reseeding, then like what will happen is the passage number will increase. So in what we are doing in subculturing is that we are removing the medium and we are transferring the cell lines from one medium to another in a different growth medium. So that will help the cell line or that particular cell to propagate. Okay, so it will not decrease the passage number. But if we reseed this particular cell line, then the passage number will increase. So the correct answer for this problem is problem 7 is false. Okay. So when we are subculturing cell lines, that is we are transferring the cell from one particular culture to another culture. So there is the passage number will not decrease. However, like it can increase if we are like propagating the cells in uh, by a process called reseeding. Okay. So now let us move on to next problem, problem 8. After fabricating few hundreds of MEMS-based pressure sensors, it was found that the sensing area and the electrodes needs a conformal deposition by protective film to avoid contamination. Which tool must be procured by the team to realize the same? Option A is sputter deposition tool, B is Parylene deposition tool, C is Teflon coater, D is epoxy film coating system. So which one is used to like which one should be procured by the team in order to do a conformal deposition of protective film? That is the same thing. It is same as passivation. We are doing passivation, and which tool can we use to do the passivation? Okay, so you would have learned about different deposition techniques, right? Like physical vapor deposition and chemical vapor deposition techniques. Also, we also learned about something called as ELD, atomic layer deposition. So we know that like physical layer deposition techniques will not give us conformality. So like A is sputter deposition, which is a physical vapor deposition, right? So it is wrong. What we need is like a passive, something called as something which will give us a conformal deposition. So here the correct answer for this question is B, which is Parylene deposition tool. Okay, so Parylene can be generally coated by using some particular special apparatus. It is a chemical vapor deposition technique. However, the growth will like it will grow generally like in a way similar to atomic layer deposition. So what will happen is that in Parylene coating, we have like a solid material. So it will get converted to vapor. That vapor will get deposited on the substrate. So the solid material that is called as dimer. So what will happen is it will get sublimated without going into liquid phase. Then in the gas phase, the it will form some kind of monomer when it is at very high temperature, and this one will for it will coat the desired MEMS device, and once we cool, the Parylene vapor will turn into a polymer. So this is what happens in Parylene deposition. Dimer gets converted into gas phase. So then what will happen is, due to the high temperature, which is around 700 degree, the dimer will break down, and the Parylene vapor will be formed. This Parylene vapor will it will kind of coat the material, and when we cool the system, what will happen is it will form a solid. So that's how the Parylene coating is forming. So it's like molecular, the coating will be at molecular level. So it will have a very conformal coating. Okay. And we can get thickness from 100 Armstrong to micron range thickness. Next is problem 9. A part of the HVAC, which is heating, ventilation, and air conditioning system in a clean room that regulates particulate contamination is what? Option A is air curtain, B is HEPA filter, C is NEPA filter, and D is air distributor system. So what like we know that in a clean room environment we have to maintain heat, ventilation, and air conditioning. Generally, this heating and air conditioning is to maintain it at suitable temperature. We also need to ventilate the system. So what are we using to regulate the particle contamination? What is the correct answer for this? What are we using to regulate the particle contamination? Okay, so what is the correct answer? The correct answer is option B, which is HEPA filter. Okay. So what does HEPA stands for? HEPA. It stands for high efficiency particulate air. So HEPA is high efficiency particulate air. So they are generally mechanical filters. So these filters, what they do is they will have like a variety of they will have many sections with lot of filtering materials, and it can remove very much particles in the size of zero point 0.3 micron meter. Okay. So in order to use a HEPA filter, what we will have is we will so if this is like clean room, we'll have HEPA filter somewhere here at the top, and we will create some laminar flow of air. Okay. So when we have a laminar flow of air, then like if we have a HEPA filter here, it can easily separate and remove any physical particles which are having size greater than zero point 0.3 micrometer, which are present in that particular stream of gas. Okay. So by doing that, they can create a contaminant free environment. And you know that the class of a particular clean room is defined on like how many particles that are present, and also on the size of the maximum size of the particle that is present. So this HEPA filter have a very high standard of particle filtration. I mean, they can reduce the number of particles present to very less value. Yeah. So it also uses various kinds of mechanisms in order to trap the particles that are present in the environment. So the correct answer is option B, HEPA filter. Let's say for clean room environment also requires odor removal, then in that case we use something called as HEGA filter, HEGA filter. Okay. So if we just want to reduce the particle contamination, then we have HEPA filter, high efficiency particulate air. But if you want to remove odor also along with particle contamination, then we will use something called as HEGA filter. So now let us move on to next question, problem 10. Cell or tissue culture in an in vitro condition does not retain its functions even though the growth is in artificial environment. Option A true, option B false. So which one is the correct answer? So here we are looking at what kind of environment it is, in vitro condition. Okay. When we are doing tissue culture in vitro condition, does the like cell will retain its original function or it will not retain its original function? Okay, so what kind of what is in vitro mean? Hmm. So in vitro is we are growing any plant cells or tissues or animal cells with a nutritive culture medium under stabilized conditions. Sterilized conditions. Okay. So since we are doing it in sterilized conditions, it will not be it will not mimic in vivo conditions when we are seeing temperature, pH, then concentration of gases like O2 or CO2 and so on. Okay. So these all will not be same. If it is in vivo, it will mimic exactly all the conditions that is present in the in a particular organism in which we are studying. But in the case of in vitro, what we are doing is we are culturing the cells in some nutritive culture medium under sterilized condition. So we will not be having the exact we are not exactly mimicking the actual condition. However, when we are growing, whether we are growing in vitro or in vivo, when we want to study the cell or tissue culture, we want it to retain its original function, right? So even if it is growing in an artificial environment, only when it is retaining its function, then only you'll be able to study it. So here the correct answer is option B, false. Okay. So when we culture in vitro, also it will retain its original functions. However, the growth will be in an artificial environment, instead of trying to replicate the actual environment. So now let us move on to problem 11. Okay. Problem 11. Atrial fibrillation is a heart condition where option A, heart beats rhythmically. Option B, electrical signals pumping into the heart misfires. Option C, uneven flopping or racing heartbeat. Option D, both A and B. Option E, both B and C. So which is the correct answer? Hmm. So which one is the correct answer? So we know that it is a heart condition. So what is atrial fibrillation? What happens when we are having atrial fibrillation? Okay. So atrial fibrillation is before that yeah, let us see. Atrial fibrillation is heart is beating irregularly, and this happens, it starts in your upper chamber called as atria, so that is in the name itself. And it what will happen is, since your atria is not pumping properly, it can lead to like blood clot or stroke or heart failure, because in a regular beat, if your heart is expanding and contracting, then the blood will flow accordingly. However, since your atria is not beating regularly, then the flow of blood that is pumped out of the atria will not be proper. So this will cause some amount of blood to get accumulated in your atria. When blood is accumulated, it can clot. So if clot is formed, that clot can either it can block your heart, or if it goes to the brain, it will cause stroke. Okay. So atrial fibrillation, we know that it is irregular heart condition. Okay. Now, I think in question one, we saw that electrical impulses are flowing through the heart, and that is what causing the contraction and the expansion of the heart muscles, right? So, and atrial fibrillation is what your artery is not contracting and expanding at the rate that it should. So what will cause the contraction or expansion of your artery? It's the electrical signals that is pumping into the heart. If it is misfiring, then it will not ever. So B is correct. Okay. Then what will happen is, since your rhythm is not proper, you will have either uneven or flopping or even racing heartbeat. So option C is also correct. So the correct answer for problem 11 is option E, both B and C. Okay. So, atrial fibrillation is heart condition where your electrical signals are pumping into the heart that they misfire, or you have a uneven flopping or racing heartbeat. Okay, so that's the correct answer. Now let us move on to next question of problem 12. Electrocardiogram is used to detect AFib. So AFib is arterial fibrillation. In AFib, the heartbeats are evenly placed and shows a regular pattern. So is this true or false? So this we saw in the previous question as well. So what is the correct answer for this? Okay. So the correct answer is it is false, right? So if the heartbeats are evenly spaced and showing a regular pattern, then it is not atrial fibrillation. In atrial fibrillation, your artery does not contract as it should. So what happens is, because of that, blood flow will not be proper. So that is uh, hmm, what is called as AFib. So, if you see your regular heartbeat, which will consist of P waves, QRS complex, and the T wave. In your if you're having arterial fibrillation, the pulse rate will not be. First of all, if you compare both normal ECG and some ECG with someone who is having AFib, then you can see that the normal heartbeat will be it will be spaced at a particular interval. However, if a person is having AFib, then the interval between each of heartbeat will be different, and also there will be some irregular pattern that is present. It won't be a regular pattern that is repeating in some periodic intervals of time. Okay, so the correct answer for problem 12 is the heartbeats are not evenly spaced and they do not show a irregular pattern. So option B is correct, which is false. Now let us move on to next question, problem 13. Okay. So medical procedures used to treat AFib includes option A, catheter ablation, B, cryoablation, C, pacemaker, D, all of the above, option E, only A and B. So which is the correct answer? Medical procedures used to treat AFib includes option A, catheter ablation, B, cryoablation, C, pacemaker, D, all the above, E, only A and B. So how do you treat AFib? Okay, so in order to treat atrial fibrillation, there are different mechanisms. So one is called as electrical cardioversion. So here what they will do is they will give some low energy shocks to the heart. So by doing that, they'll try to restore your normal heart rhythm. In the second one, we have something called as catheter ablation. So here what they will do is they will destroy the tissue that is causing the arrhythmia. This procedure is not always successful, and some cases it can cause any complication. And there is also a risk that the arterial fibrillation will happen again. So if it happens again, what they will do is they will try to repeat the procedure. Since we want to reduce the risk for this atrial fibrillation to happen again, what they in the catheter, no, they will have this contact force sensing, so which is a smart catheter. They'll be able to sense how much contact force you are giving while you are using the catheter for ablation. So by when you are giving a particular amount of, by controlling the contact force that you are giving, you can do a better ablation of the tissue. So third one is pacemaker. So people also use pacemaker to reduce the atrial fibrillation. So there are certain other methods also to reduce the atrial fibrillation. So one of the treatment is catheter ablation. In another, they can also use very low temperatures to ablate the tissue, which is called as cryoablation. So to treat arterial fibrillation, we can use catheter ablation, cryoablation, or a pacemaker. So the correct answer is option D, all of the above. That is the correct answer. So to treat atrial fibrillation, we use the three methods: catheter ablation, cryoablation, pacemaker. Okay. There is also surgery option in order to treat the atrial fibrillation. Okay. Now let us move on to problem 14. Now let us move on to problem 14. A catheter is the tool used to treat atrial fibrillation. It is used to option A, map the electrical signals of the heart. Option B, ablate those areas that are misfiring. Option C, both A and B. Option D, neither A or B. So what is the correct answer for problem 14? So it is kind of a repetitive question. Hmm. What is the correct answer? What is the correct answer? So the correct answer for this question is option C, both A and B. So we already know that we can ablate the areas which are misfiring, right? So that we know. And also at the tip of the catheter, we'll have some kind of sensors. So those sensors will try to map the electrical signals of the heart. So it will give you detailed activity of how the uh, electrical activity of the heart is. So from that you can kind of know where the issue that is causing the atrial fibrillation is present. So if there is some particular tissue that is causing, you can try to ablate the tissue. If you are ablating the tissue, you will kind of create some pathway for the current to flow through, means the electrical signal to flow through properly. Yeah. Now let us move on to problem 15. In catheter ablation, the non-ionizing RF radiation is used to heat a small area of tissue that is triggering a rapid or irregular heartbeat. Is this true or false? So, what is the correct answer for this? We are using a non-ionizing RF radiation so that we know. And like what we use it to heat the small area of a tissue. When we are heating the tissue, what happens is that the first is coagulation happens. So the blood starts to thicken, and this will like cause certain parts of the tissue to not receive any blood. Once the like the cells which are not receiving any blood will start to die, and that is called as necrosis. So that means like the particular tissue will start to die. So ablation is like we are trying to destroy that particular tissue as well as a function. So the correct answer is true. True. Okay. Now let us move on to next problem. Problem 16. Now let us move on to next problem. Okay. Catheter. Catheter contact force measurement is extremely important. Why? Option A. If the force applied is more, then the region which are not needed to be ablated will also get ablated. Option B. If the force is less, then the recurrence rate will be higher. Option C. Effective lesion formation. Option D. All of the above. So why do we want to have this catheter contact force measurement? A particular catheter contact force measurement. So we already know that we have to have some kind of feedback reading from the catheter when we are doing this procedure, right? Catheter ablation. Why do we need to do that? Because we want to know how much, like whether we are ablating it properly or not. Right? So during the ablation, like the lesion will be formed. So option C is correct. And if you are giving more force, then the region which is not required for ablation will also get ablated. So option A is also correct. If you are giving less force, what will happen is the recurrence rate will be higher. Option B is also correct. So the correct answer is option D, all of the above. Yeah. So this problem 16. Next is problem 17. Problem 17 is effective lesion formation. Option A increases recurrence. Option B decreases recurrence. Option C decreases need for reablation. Option D both A and C. Option E both B and C. So like this again related to the previous question. What is the correct answer? And we saw the explanation also in previous question, right? We need to form an like lesson properly. Then only we can reduce the reoccurrence of the atrial fibrillation. And also, let's say if your initial ablation is not done properly, then you have to do a reablation, not to like stop the irregular beating of the heartbeat. So both B and C are correct. The correct answer is option E, which is telling the options both B and C. Okay. Is this clear? Okay. So here we need to have an effective lesson formation so that we can decrease the reoccurrence of atrial fibrillation, as well as we don't have to do the ablation procedure again. Okay, so that's why we need to have effective lesson formation. So this effective lesson formation can be like we can make it possible by having some sort of force sensor at the tip of the catheter, which will like help you to determine how much actual force that you have to give to properly ablate the tissue. Okay, so is this clear? Now let us move on to next problem. Problem 18. standard RF low power catheters are preferred over cooled RF high power catheters. So we know that we are using RF power catheter. And is this true or false? Mm. So is this true or false? The correct answer is option B, which is false. Okay, so why is it false? Like what happens? What are we doing in like the catheter? Is that we are sending current at RF. So if the power of the current is high, if the power of the signal that we are sending through the cell is high, then the ablation will happen faster when compared to sending low power, right? So we prefer high power catheters in order to ablate the cells faster. However, what happens is in that like along with higher power, we also have higher temperature. That is a lot of heat that is generated. So when we are having a higher RF power catheter, we will cool the electrode through which the RF energy is delivered. This will prevent any like high temperature to be formed at the uh, tip of the tissue where that catheter tip is making into contact. So if there is like a lot of energy that is like supplied through the catheter tip, and at the point of contact, like there is lot of temperature, then what will happen is some sort of coagulation will form, or it may start to get like burnt at the electrode tip. Okay. So if we are having um, if you are cooling that higher RF power, only at the tip we will have this large amount of energy which is supplied, and also like it will not the temperature will not distributed out along the entire catheter. It will be concentrated in the tip. Also, we can easily provide higher temperatures. Like with higher power, we can do more efficient ablation. Now let us move on to problem 19. The 3D force sensor for catheter force sensing discussed in class is based on option A, capacitive sensing, B, strain gauge, C, piezoelectric sensing, and D, optical sensing. So here you can see image of the 3D force sensor which is attached to the catheter tip. Okay. So what kind of sensing are we using for this particular force sensor? So again, force sensor is converting force into some sort of electrical signal that we want to measure. Okay. So what kind of mechanism are we using to measure the electrical signal? It's a direct question. Okay. So the correct answer is option B, strain gauge. Alright. So what is a strain gauge? A strain gauge is something that will that can be used to measure the strain of a particular material. So strain is generally it is change in length by original length. It can also be used to study so not only we have metal based strain gauges, we also have semiconductor based strain gauges which work on the piezoresistive sensing. So it will convert force into change in resistance, and we can sense this change in resistance by connecting the resistors in a particular Wheatstone bridge configuration. So the correct answer for this problem is for force sensor we are using a strain gauge where we are converting the force into change in resistance, or generally change in length of the material. Okay. So which is a better material for a question 20. Okay, problem 20. Which is a better material for strain gauge? Metal or semiconductor? So as I told before, we have like two kinds of materials which we can use in a strain gauge, right? Uh, One is metal, or we can also use a semiconductor. How do you determine whether metal should be used or semiconductor, which will give you better performance? Okay. So there is something called as gauge factor that we are using to determine whether a particular whether metal is good or semiconductor is good or not. So gauge factor is generally change in resistance to original resistance divided by change in length to original length. So this is how much your resistance changes with change in length of your material. So if you like this is a particular constant value, and it like for each material it will vary. If you consider the metal like for metal, the gauge factor will be like in the range of 2 to 5. However, if you consider materials like silicon, single crystalline silicon, then the gauge factor is around 125 to 200. So which is almost like 20 times higher, 20 or 50 times, no, 25 times higher. Sorry, 20, which is generally 40 times higher. You can say it is 40 times higher than that of a metal. So since this gauge factor is measuring change in electrical resistance to the mechanical strain, we can say that like single crystalline silicon is having a better gauge factor, so it will be a better material for sensing the strain, right? Because for a particular change in strain, we need to have more change in resistance. That way, we'll be able to sense even small change in the strain in the material. Okay. Uh, One question here is, I think, yeah. Okay. Like, we'll move on to the next question. Okay. Problem 21. Semiconductor strain gauges have much higher gauge factor than those of metallic strain gauges, primarily due to option A, high temperature sensitivity, option B, higher Poisson's ratio, option C, higher piezoresistive effect coefficient, option D, higher magnetostrictive coefficient. So, which is the correct answer? So we already saw in previous slide that semiconductor strain gauges are having more higher gauge factor. And what is the reason? So what is gauge factor? Gauge factor is change in resistance divided by gauge factor is like delta R by capital R divided by delta L by capital L. So this is a relative change in resistance to change in mechanical strain. So relative change in resistance to mechanical strain. So if we see the resistance, right, it is rho into L divided by A. So if we are taking delta R, which means it can be variation in the resistivity of the material. So that will be delta rho. Okay. And delta rho into L divided by A plus rho into it can be due to change in the length. It also can be due to change in the area. So that will become minus 1 by A squared into delta A. So if we take delta R by R relative, then you will end up with delta rho by rho plus delta L divided by L uh, minus delta A divided by A. So yeah. So here the change in resistance is not only due to change in the length, it is also due to change in the resistivity of the material, or it can be also due to change in the area. Okay. I think here 1, 2 will come. 2. So, yes, 2 will come. Uh, Delta A by E. So, generally the piezo-resistive effect, right? The piezo-resistive coefficient. It is the change in the uh, resistivity of the material due to change in the strain. So, we'll all divide this by entire strain. Here we know that this delta L by L and delta A by A, they are geometrical terms. Means it is change in the length of the gauge or it is a change in the area of the gauge. That is what will cause the change in the strain. However, this delta rho by rho, this is change in the resistivity. So in the case of semiconductor materials, this is that delta rho by rho is very much higher. Okay. Whereas in metals, it is very much low. That's why they have a lower gauge factor. Okay, so this is all for this week. Any questions? Is there any question? If not, we can end this session. Thank you.